I'll definitely take care of this patient here in this room. Yeah, no, I got it. Hello, hi. Welcome into the triage area. We have as your admit chief complaint that you have developed an abscess underneath your arm. Appears to be infected. You're in a lot of pain. Okay. Steadily over the past few weeks. Okay. Any trauma to the area? Do you see pus coming out of it? A little bit. Okay. Are you having any fever or chills? Okay. Yeah, I'll check your temperature too. My name is Lee, by the way. I just kind of run through the triage patients, get your vital signs, and just kind of confirm what brought you in. And then we will bring a provider in, and hopefully they will help resolve your concern for sure. Have you ever needed an abscess drainage before? Okay. They used to. Okay. I see. Yeah, that's definitely frustrating for sure. Oh, I believe it. Yeah. Okay. Alright, let me make sure I have everything. I have my blood pressure cuff. I have my stethoscope hanging on the wall here. Okay, I think we're good. So, if you could confirm your date of birth for me, because we'll have you sign a few consent forms if you want the providers in today to train that for you, which I think would definitely give you a lot of relief. Yeah. Okay, date of birth. And we just have like a standard procedure consent, basically saying you understand of possible risk to infection. Same stuff as last time. Yeah. Okay. And then any current medications that you are using right now? And how often? For what condition? Any recent surgeries at all? Are you being under anesthesia? Okay. Any recent travel? Yeah, specifically outside the country? Okay. And currently any substance use? Okay. All right. So now, what about alcohol? Yeah. Okay. So pretty rarely. Okay. And sorry, have you experienced fever, chills? I may have missed that. Okay. Alright, let me get this consent form fixed up here for you. And I am just going to have you sign it. Just so we have it on record in your chart. And then I'll get your vital signs, and then we'll bring someone in to drain that, okay? Okay, you're just going to want to sign right here. Oh, sorry. Here's my pencil. Thank you. Appreciate it. Alright, now what I'm going to do is just get your vital signs, and then we'll get things going. Let me grab my stethoscope here. Any questions? Just making sure. Before I use this arm, if you could just keep both feet flat for me. Yes. You can rest your arm on my table there if you want. Just have you just slide your arm through there. Go. Does that feel kind of snug? Okay. As long as it doesn't like fall off, you know what I mean? Okay, let's get this going. Okay. pressure is about 135 over 73. Yeah, a little bit high, but nothing too crazy. Yeah, it's pretty stable. Totally. Makes sense for sure. Alright. Let me just set this up. Okay. Let me jot that down here. Okay. Let's do a temperature check. This is going to be underneath the tongue, a sublingual temp, okay? Yep, just takes about a few seconds. Maybe longer than what you're normally used to, but just like to warn people. Okay. Let's go. Stuff that in the garbage. Okay, this is gonna go right underneath the tongue, okay? Sorry, it's been acting up all day. Okay, good. Awesome. Temperature is normal. Put all that back. Okay. So vitals appear stable, so we'll definitely proceed with that drainage for you ASAP. So consent forms have been signed, no known drug allergies. The assistants are going to come in, they're going to prep the area, and then one of our providers will come in to drain it for you, of course. I wouldn't be surprised if they sent you home with some antibiotics maybe, just to, again, further the likelihood of it ever getting infected. But yes, yeah, we definitely don't want it getting infected by any means. Do you have any questions for me before I go give your chart to one of the providers? Yeah, no, I think you'll do great. I know you kind of know what to anticipate with it not being your first one, but we'll take good care of you, and hopefully you'll be in and out real shortly, okay? Awesome. Well, thank you so much. I'll tell the providers to come in now. Yes, yep. I am walking in there right now. Hello, my name is Leanna, and I will be the one to drain your abscess for you underneath your arm here. I heard this wasn't the first time. Gosh, I'm sorry. Yeah, I imagine it's a little bit annoying, that's for sure. Alright, so I looked over your chart, went over any allergies, that sort of thing. You signed the consent form. Do you have absolutely any questions at all before I get started? Okay, and I'll just have my team here to help me if need be, okay? I'm pretty self-sufficient. Yeah, absolutely. Okay, so what I'm gonna do is I'm just gonna grab some gloves. I am gonna put some goggles on just because we're working with a sterile field. Personal protection equipment, you know what I mean? It's a small procedure, but you never know how much they'll kind of pop, you know? Exactly. Just staying cautious, that's for sure. Alright, so for documentation, I am just going to have to measure the area. We'll get everything. If it is draining, we'll assist it more in draining, kind of get everything cleaned up and that sort of thing, okay? Yeah, to be honest, I don't know if you'll need any stitches for sure. Might just be a drainage. I think that's probably what we're looking at. Okay, just making sure you're on the same page. I am just going to want to turn on the light here. Doesn't have to be that bright on you, but just to kind of help us see that area a little bit better. Okay. All right, so first things first, let me just get a few measurements here, okay? And of course, you let me know if you ever get uncomfortable. Okay, yeah, I see a little bit of drainage, but we will numb you up and probably make the site opening a little bit wider just to kind of help that process along. Gonna use one more tool here. Yeah, if you could document, it's like a 2 by 5 by 1. Yep, exactly. Thank you. All right, let me put these on here and we'll get this going. I have to be honest with you, these are some of my favorite procedures. So I almost want to thank you for coming in, but I know you don't want to be here. All right, so let's sterilize the field here, you guys. We're going to sterilize. Just kind of get that area good to go. Just going to grab some gauze. Use this one just to kind of do it gently. And then we will get you numbed up. Guys, where can I find... Got the antidepride, but the lidocaine. Is it just me who can't see the lidocaine? That's kind of the most important part for her. Is it just me? Oh, I found it. Don't worry. We were not going to do that without lidocaine. Okay, let me try here. Here. Okay, just move your arm a little bit. There you go. That's good. Area numb here. Can you fill it for me? Thank you. All right, this is probably going to be the most uncomfortable part, just numbing medicine, okay? Okay, ready? 3, 2. There you go. You're doing great. And we're going to do a Sharps test to make sure that that medication is doing its job, okay? Or so. Okay, and let me know if you feel if it's sharp or dull, okay? Okay, about there. There. Good, perfect. All right, excellent. That here. So we already have a little bit of an opening. We're just gonna make it slightly larger, okay? You let me know when you're ready. Okay, here we go. Just gonna. Okay. Yeah, and then we're gonna grab some more gauze. We're gonna do a lot of squeezing, draining it out. You're gonna feel me press a lot here. Yeah, just really helping that abscess drain. You're doing great. Okay. I am gonna wanna just do a collection here just to send it out for any specific bacteria. So we'll send that to the lab so we know if there's any bacteria that's more resistant to antibiotics. Okay. We definitely got a lot of that pus out, so that's good. All right, can we get the aerating? Okay, this is just to kind of clean up the area here, clean the wound. That's all we're doing here at this point. Hopefully, ideally, you'd go the rest of the year and never get one of these things. Do you know, like, what triggers it at all, or not sure? I imagine that's frustrating, yeah. Okay, a little bit more. Just kind of cleaning that wound up. Yeah, I don't think you'll need any stitches at all. We will wrap it up for you. Okay, she's good to go there, you guys. Put probably like an antibiotic cream on there for her definitely before she goes. But let's take a look inside real quick. I think we drained that pretty well. Yeah, no, it's looking really good. Okay, let's get, if I can get the antibiotic cream. Thank you. Okay, if I can get a swab. Thanks. Awesome. Yeah. Nope. Looks good. We will probably want to send her some antibiotics if we have a container for her. Yeah, I think so. Let's get some gauze here. Just gonna do a little bit of pressing. Any drainage that you see? No, yeah, she looks good. Okay. So I've got a gauze there that I'm holding for. Take down your tape. Tape. Oh, thank you. Another tape, please. Thank you. Okay. Let's clean around the area for her, just so her arm doesn't have all this creams and meds and stuff. Here, I'm gonna have this kind of wrap around there. Okay, and then for documentation purposes, it's looking now at about a 0.3 to 0.5. Yeah, that's her blood pressure right now. That looks fine. Okay, good. All right, excellent. So, Abscess has been drained. Can I get the antibiotics for her? Thank you. I'm gonna give you some antibiotics for you to take home a couple times a day for the next 7 days, just to prevent like any systemic infection or anything like that. So I'll leave these with you, so you won't have to go to the pharmacy, which is nice. I'm gonna have one of the assistants just kind of keep an eye on you for the next 20-30 minutes before we discharge you, okay? Yeah, no, other than that, the abscess drainage was successful and it is complete. Of course, if you have any questions, feel free to ask any of us while you're still here. Otherwise, I hope it just doesn't happen again for you, or we're at least able to identify maybe a cause so we can avoid it if possible. Yeah, no, I agree 1000%. We could turn that light off. All right, well, I am going to give you some privacy, and then you will be all set, okay? All right, it was a pleasure meeting you. Bye. I'm all done. Yep.